Jonathan Marchand is 43 years old and living in a long-term care home about 40 minutes outside of Quebec City. He has muscular dystrophy and is an advocate pushing the government to help people with disabilities move back into their communities during this time. Many of those needing 24-hour care are living in homes for senior citizens in Quebec, and COVID-19 is making his push to be able to get out of long-term care homes, he says, more urgent. Jonathan Marchand is president of Co-op Assist. He joins us from his residence at l'Hôpital de Sainte-Anne-de-Beaupré. Hi, Mr. Marchand. Jonathan, nice to see you.
Nice to see you too.
Thanks very much for making time for us. I want to start off just by asking a little bit about where you're living. So you're in a smaller regional hospital, my understanding is, with approximately 175 long-term care beds. What is it like there right now?
Right now, there's no confirmed case. We're about 40 minutes from Quebec City. There are cases in Quebec City. There's some facilities that are currently infected, and there's still workers going around between those facilities. So to me, it's only a matter of time before there are cases here, and I find that quite distressing.
Yeah, I was going to ask what is your level, I guess, of stress, your level of nervousness about what you're seeing unfold in other long-term care centers?
It's extremely troubling, and I've been following what's happening since December last year. I've seen what happened in all the European countries, in the United States, so I knew what was coming here, and it seems like we're powerless to stop it. And we largely knew what was coming, and the government it failed to act, and it failed to take into account the experience of the other countries, and I find that very deplorable.
What about what's happening where you're at? Have you seen any changes, for example, since we started hearing more about this, at least at the political level? Are staff being asked to take extra precautions? Is there enough, for example, personal protective equipment? What are your impressions there?
Very few things. Actually, only maybe 5 or 6 days ago, staff started to wear a mask. They only have 2 masks per 8-hour shift, which is not enough. Workers are still being shared between multiple facilities, and also there's no wide-scale testing, and there's still new admissions for respite care, for example. So patients still are allowed in the facility. So there's not enough being done. Even though the government 2 weeks ago said there would be mass testing, they would stop sharing the staff, but it's still happening today. So it's quite unnerving what's happening on the ground. It seems like nothing is changing.
You're right, because it doesn't match with the political rhetoric that we're hearing. We get quite a few messages from the province. We hear the premier, we hear even the federal government chiming in about guidelines and changes that are coming or have already come according to them. But what you're describing is very different than what we hear from them. If they are watching right now, what is your message?
It's too slow. Well, you need to act decisively. Stop messing around. It's like they make decisions, and it can take weeks or months to be seen on the ground. We need to be agile during this crisis, and they need to act quickly. I don't understand why it's taking so long. How can we face this crisis if we can't act quickly? How are we going to manage? It's very difficult, and what I want is to go back home to be able to protect myself, because here I'm trapped and I got to wait for the government to come and save me. That's not a good strategy. I don't need the government to come and save me. if I would be at home, I could protect myself. I could have control over my environment and control and choice over the staff who provide care for me. But right now, I have no control over anything, and I'm powerless to do anything. Even if I want to protect myself here, I can't. They will stop me. So uh, the idea to that I can stay here and be safe in the long term is completely absurd. I'm just waiting for the inevitable to happen. And if the virus doesn't get me, the lack of service or the despair will, I need to get out.
When you say that you want to go home, can you explain a bit to us what you mean by that? I think there are programs in other parts of the country where the government offers subsidies to facilitate staff at your home. Is that correct?
Yeah, that's correct. There are personal assistance programs in Ontario, in BC, in Manitoba, in the United States, in Europe, in Australia that enable people with disabilities and seniors as well to live in the community. Even people who need extensive assistance. I need 24-hour assistance. So what I'm asking is part of the money that it costs to keep me here so that I can manage my own care and hire my own assistant and train them and manage everything. So with that, I could go back in the community, go back home, and be able to live safely in the community. But right now, it's not possible in Quebec. I tried everything to make that a reality here, but the government refused to allow that. So I'm trapped here, and there's no way out, and there's nothing I can cling on to be hopeful. I just want to be able to live like any other Canadians in the community, and it can be done very quickly. I'm ready to go, but I need the funds to enable that. So I'm asking Premier Legault to authorize my release. Bill Blair, the public health minister, is asking prisons to release inmates during this crisis. Why am I not able to get out? Why are they keeping me here?
It's an understandable question. Mr. Marchand, Jonathan, thank you very much for making time for us this evening. I really appreciate you doing so.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.